Good day everyone. We are the Group 3 and for today we are going to discuss about the drugs affecting blood coagulation. So without further ado, let's get started. And here are the members of Group 3. But before I formally start, let me first read our learning objectives. So at the end of this video, you are expected to know the different drugs affecting blood coagulation and its mechanism. Also the pharmacokinetics, the side effects, contraindications, drug-to-drug interactions, and nursing considerations. Hello, I am Hena Belomake and I am going to discuss about blood coagulation. So what is blood coagulation? So blood coagulation is a complex process that involves vasoconstriction, platelet clumping or aggregation, and a cascade of clotting factors produced in the liver that eventually react to break down fibrinogen, which is a protein also produced in the liver, into insoluble fibrin threads. When a clot is formed, plasmin, which is another blood protein, acts to break it down. Blood coagulation can be affected at any step in this complicated process to alter the way that blood clotting occurs. In addition, blood clotting or coagulation is an important process that prevents excessive bleeding when a blood vessel is injured. Platelets, which is a type of blood cell, and proteins in your plasma, which is the liquid part of blood, work together to stop the bleeding by forming a clot over the injury. Typically, your body will naturally dissolve the blood clot after the injury has healed. But sometimes, clots form on the inside of vessels without an obvious injury or do not dissolve naturally. So that is it for my report, and now let's move on to the next reporter.
I am Jennifer Marapok and I'm going to discuss about drugs affecting blood coagulation for adults. Receiving these drugs need to be instructed in ways to prevent injury, such as using an electric razor instead of a straight razor, using a soft bristle toothbrush to protect the gums, and avoiding contact sports, and instructed in what to do if bleeding does occur. They should receive a written list of signs of bleeding to watch for and to report to their healthcare provider. Drugs affecting coagulation to children. If they are used, the children needs to be monitored very carefully to avoid excessive bleeding related to drug interactions or alteration in gastrointestinal or liver function. People who interact with the child needs to understand the importance of preventing injuries and providing safety precautions, and should be aware of what to do if the child is injured and begins to bleed. So, for the older adults, may have many underlying medical conditions that require the need for drugs that alter blood clotting. Statistically, older adults also take more medications, making them more likely to encounter drug-to-drug interactions. Associated with these drugs, the older adults is also more likely to have impaired liver and kidney functions, conditions that can alter the metabolism and instruction of these drugs.
Hi, I'm Lucila Abigail Velarde explaining the drugs affecting clot formation and resolution. So, drugs that affect clot formation includes antiplatelet drugs, which alter platelet aggregation and the formation of the platelet plug, anticoagulants, which interfere with the clotting cascade and thrombin formation, and thrombolytic agents, which breaks down the thrombus or clot that has been formed by stimulating the plasmin system. And moreover, antiplatelet agents decrease the formation of the platelet plug by decreasing the responsiveness of the platelets to stimuli that would cause them to stick and aggregate on a vessel wall. Antiplatelet agents available for use include abscisimmab or Reopro, anagrelide or agrelin, aspirin, cilostazol or Platal, clopidogrel or Plavix, dipyridamole or Persatin, actifipatide or Integrelin, ticlopidine or ticlid, tisagrelor or brilinta, and tirofiban or agrastat. So let's move on to the next reporter.
Therapeutic actions and indications. The antiplatelet agents inhibit platelet adhesion and aggregation by blocking receptor sites on the platelet membrane, preventing platelet-to-platelet interaction or the interaction of platelets with other clotting chemicals. One drug, anagrelide, blocks the production of platelets in the bone marrow. These agents are used effectively to treat cardiovascular diseases that are prone to produce occluded vessels, for the maintenance of venous and arterial grafts, to prevent cerebrovascular occlusion, and as adjuncts to thrombolytic therapy in the treatment of myocardial infarction and the prevention of reinfarction after MI. The prescriber's choice of drug depends on the intended use and the patient's tolerance of the associated adverse effects.
I am Jennifer Marapok, and here are the list of drugs under antiplatelet agents: abciximab, anagrelide, aspirin, xylostazol, clopidogrel, dipyridamol, eptifibatide, ticagrelor, ticlopidine, and lastly, tirofiban. Let's move on to the next reporter.
So, for the pharmacokinetics of the antiplatelet agents, I, Elma Suzanne Lite, will explain it further. So to start, for the abciximab drug, its concentration decreased rapidly for it has an initial half-life of about 30 minutes, reflecting the rapid binding of the antibody to GP2B to 3A, with 65% of the antibody becoming attached to platelets in the circulation and spleen. Next is the eptifibatide are linear and dose proportional for bolus doses ranging from 90 to 250 mcg kilogram and infusion rates from 0.5 to 3.0 mcg kilogram per minute. Plasma elimination half-life is approximately 2.5 hours. Next is the tirofiban. Is a non-peptide tyrosine derivative that selectively bind to GP2B to 3A. So the plasma half-life of this drug is 1.5 to 2 hours. And both renal and biliary excretion contribute to tirofiban clearance, with unchanged tirofiban found in urine and feces. Anagrelide is extensively metabolized primarily in liver. The half-life of this drug is 1.5 and 2.5 hours respectively. Next is aspirin. Is rapidly absorbed in the stomach and upper intestine. Plasma level peak 30 to 40 minutes after aspirin ingestion, and inhibition of platelet function is evident within an hour. In contrast, it can take 3 to 4 hours to reach peak plasma levels after administration of enteric-coated aspirin. Therefore, if a rapid effect is required and only enteric-coated tablets are available, the tablets should be chewed instead of swallowed intact. The plasma concentration of aspirin decays with a half-life of 15 to 20 minutes. Next is the xylostazol. Co-administration of food increases the rate and extent of drug absorption. This drug is highly albumin-bound and is extensively metabolized by cytochrome P450 cytochrome P450 enzymes, with excretion of metabolites in urine. It has a half-life of 11 hours, and the half-life is prolonged in patients with severe renal impairment. Next is clopidogrel. Is rapidly absorbed and metabolized through a two-step process to generate a highly labile active metabolite that irreversibly binds to platelet P2Y12 receptor when platelets pass through the liver. It has a half-life of 8 hours. Next is ticagrelor. Is rapidly absorbed with a median time to peak concentration of 2 to 3 hours after multiple twice a day oral dosing. This drug is extensively metabolized with ticagrelor and its active and approximately equipotent metabolite composing the major circulating components in the plasma. So next is the cyclopidine. Up to 90% of a single oral dose of this drug is rapidly absorbed. Plasma concentrations peak 1 to 3 hours after a single oral dose of 250 mg. Next is the dipyridamole. It's a highly protein-bound to albumin eliminated primarily by biliary excretion as a glucuronide conjugate and is subject to enterohepatic recirculation. A terminal half-life of this drug is about 10 hours has been reported. Addition to that, abcimab, eptifibatide, and tirofiban are administered intravenously or through IV. Antiplatelet agents that are administered orally include anagrelide, aspirin, cilostazol, clopidogrel, ticagrelor, and ticlopidine. Dipyridamole is usually orally or as an IV agent. These drugs are generally well absorbed and highly bound to plasma proteins. They are metabolized in the liver and excreted in the urine, and they tend to enter breast milk. Now, let's move on to the adverse effects of these drugs. The most common adverse effect seen on these drugs is bleeding, which often occur as increased bruising and bleeding while brushing the teeth. So the other common problems are, for our central nervous system is headache, dizziness, and weakness. So the cause of these reactions is not understood. Then for our gastrointestinal are nausea and gastrointestinal distress or GI distress, such as vomiting and stomach or abdominal pain, which may occur because of the direct irritating effects of the oral drugs on the GI tract. Also, skin rash is another common effect, which may be related to the direct drug effects on the dermis.
Hi, good day everyone. My name is Otiotion Officer Choi and I will be talking about the contraindications and cautions of antiplatelet agents drugs. Antiplatelet agents are contraindicated in the following: presence of an allergy to a specific drugs to avoid hypersensitivity reactions. Caution should be used in the following condition. Note: a caution should be used in the following condition. 1. The presence of any bleeding disorder because of the risk of excessive blood loss. Secondly, recent surgeries because of the increased bleeding in unhealed vessels. And thirdly, closed head injury because of the risk of bleeding from the injury vessel in the brain. Although there are no adequate studies of these drugs in pregnancy, they are contraindicated in pregnancy because of the potential for increased bleeding. They should be used during pregnancy only if the benefits of the mother clearly outweighs the potential risk to the fetus. These drugs are also contraindicated during lactation because of the potential adverse effects on the fetus or the neonate. So if they are needed by a breastfeeding mother, she should find another method of breastfeeding the baby. So an anagrelide should be used with caution with any history of thrombocytopenia because it decreases the production of platelets in the bone marrow. Platelet levels should be checked regularly to monitor for thrombocytopenia if a patient is on these drugs. Thank you. Let's move to the next slide. This slide we're going to talk about the drug-to-drug interaction of antiplatelet agents. So the risk of excessive bleeding increases if any of these drugs are combined with another drugs that affect blood clotting. An example of drug interaction is aspirin. Aspirin may interact with a variety of medication, including non-steroidal and inflammatory agent, and angiotensin inhibitors. All these are examples of drug-to-drug interaction when it comes to antiplatelet agents. Thank you very much. Let's move to the next presenter.
Hello, I am Jubel Gapus and I am explaining the nursing diagnosis of antiplatelet agents. First is the nursing diagnosis. Assess for the following conditions which could be cautions or contradictions to using the drugs. Any known allergies to those drugs because of the risk of hypersensitivity reactions. Pregnancy or lactation because of the potential adverse effects on the fetus or neonate. And bleeding disorders, recent surgery or closed head injury because of the potential for excessive bleeding. Assess baseline status before beginning therapy to determine any potential adverse effects. This includes body temperature, skin color, lesions, and temperature. Affect orientation and reflexes, pulse, blood pressure and perfusion, respiration and advertious sounds, complete blood count and clotting studies. Anticoagulants are drugs that interfere with the normal coagulation process by interfering with the clotting cascade and thrombin formation. Drugs in this class includes antithrombin 3 or thrombate 3, argatroban or Ocava, bivalirudin or Angiomax, deserudin or Ipravox, fondaparinux or Arixtra, heparin for generic, and warfarin for Coumadin. And the two newest oral anticoagulants are dabigatran or Pradaxa and rivaroxaban or Xarelto. Thank you for listening, and let's move on to the next reporter.
I am Francesca Fantasy Papa, and I am going to discuss the therapeutic actions and indications. So basically, anticoagulants interfere with the normal cascade of events involved in the clotting process. Warfarin, an oral drug in this class, causes a decrease in the production of vitamin K-dependent clotting factors in the liver. The eventual effect is a depletion of these clotting factors and a prolongation of clotting times. So it is used to maintain a state of anticoagulation in situation in which the patient is susceptible to potentially dangerous clot formation. The heparin, argatroban, and bivalirudin block the formation of thrombin from protothrombin. The usual indications for heparin include acute treatment and prevention of venous thrombosis and pulmonary embolism, treatment of EF with embolization, prevention of clotting in blood samples and in dialysis and venous tubing, and diagnosis and treatment of disseminated intravascular coagulation. Because heparin must be injected, it is often not the drug of choice for outpatients who would be responsible for injecting the drug several times during the day. So patients may be started on heparin in the acute situation and then switch to the oral drug, or what we call the warfarin. These drugs include antithrombin, which provides a counter mechanism to clot formation, argatroban, that exerts its anticoagulant effects by inhibiting thrombin catalyzed or induced reactions. We also have bivalirudin, that is used together with aspirin to decrease the clotting ability of the blood and to help prevent harmful clots from forming in the blood vessels. Also, dabigatran, that decrease the risk of stroke and blood clots in patients with a serious heart rhythm problem called non-valvular atrial fibrillation. We also have what we call deserudin, that prevent deep venous thrombosis, a condition in which harmful blood clots form in the blood vessels of the legs. We also have fondaparinux. It is an anticoagulant medication chemically related to low molecular weight heparins. The heparin that is used to prevent or treat certain blood vessel, heart, and lung conditions. Heparin is also used to prevent blood clotting during open heart surgery, bypass surgery, kidney dialysis, and blood transfusion. The rivaroxaban, it is a medicine to help prevent blood clots. And lastly, the warfarin, it is prescribed for people who had a condition caused by a blood clot.
Hi, I'm Jason Nicole Perez and I am explaining the pharmacokinetics and the adverse effect. So for the pharmacokinetics, heparin is injected for or subcutaneously and has an almost immediate onset of action. It is excreted in the urine. Warfarin, the bigatran, and the rivaroxaban are used orally. All other drugs in this class is the heparin, antithrombin, argatroban, visirodin, fondaparinux, and the bivalirudin are given parenterally. Warfarin is readily absorbed through the GI tract, metabolized in the liver, and excreted in the urine and feces. Warfarin's onset of action is about 3 days. Its effect lasts for 4 to 5 days. Because of the time delay, warfarin is not the drug of choice in an acute situation, but it is convenient and useful for prolonged effect. The bigatran has a rapid onset of action, peaking in 1 to 2 hours. It has a half-life of 12 and 17 hours and is excreted in the urine after being metabolized in the liver. Rivaroxaban is also observed rapidly with peak effects in 2 to 4 hours. It has a slightly shorter half-life of 5 to 9 hours and is excreted in the urine and feces after being metabolized in the liver. Patient must use care in storing the bigatran in a dark, non-humid environment and in the original bottle, and it is only stable for 60 days from the time of bottle if open. And for the adverse effect, the most commonly encountered adverse effect of the anticoagulants is bleeding, ranging from the bleeding gums with toothbrushing to severe internal hemorrhage. Patients need teaching about administration, disposal of the syringe, and signs of bleeding to watch for. Periodic blood tests will be needed to assess the effect of the drug on the body. Clotting time should be monitored closely to avoid these problems. The patient should be also monitored for warfarin overdose. Thank you. Let's move on to the next reporter.
Contraindications and cautions. The anticoagulants are contraindicated in the presence of known allergies to the drugs to avoid hypersensitivity reactions. They also should not be used with any conditions that could be compromised by increased bleeding tendencies, including hemorrhagic disorders, recent trauma, spinal puncture, GI ulcers, recent surgery, intrauterine device placement, tuberculosis, presence of indwelling catheters, and threatened abortions. Warfarin is contraindicated in pregnancy because fetal injury and death have occurred. In lactation because of the potential risk to the baby. And in renal or hepatic disease, which could interfere with the metabolism and effectiveness of these drugs. Although some adverse fetal effects have been reported with its use during pregnancy, heparin does not enter breast milk, and so it is the anticoagulant of choice if one is needed during lactation. Drug-drug interactions. Increased bleeding can occur if heparin is combined with oral anticoagulants, salicylates, penicillin, or cephalosporins. Decreased anticoagulation can occur if heparin is combined with nitroglycerin. Warfarin has documented drug-drug interactions with a vast number of other drugs. It is a wise practice never to add or take away a drug from the regimen of a patient receiving warfarin without careful patient monitoring and adjustment of the warfarin dose to prevent serious adverse effects. Because of the many factors that can affect the therapeutic levels of warfarin, it is often very difficult to reach a stable level and maintain that level. The bigetran and rivaroxaban must be used with caution with antifungals, erythromycin, ritonavir, phenytoin, and rifampin because of alterations in metabolisms. All of these drugs should be used with caution if combined with any other drugs known to increase bleeding effects.
Hi, I'm like Isabel Talama and I'm about to tackle the nursing diagnosis. So you'll have to assess for any known allergies to these drugs to avoid potential hypersensitivity reactions. Also, screen for conditions that could be exacerbated by increased bleeding tendencies including hemorrhagic disorders, recent trauma, spinal puncture, gastrointestinal ulcers, recent surgery, intrauterine device placement, tuberculosis, presence of indwelling catheters, and threatened abortion. Also, screen for pregnancy to ensure that benefits outweigh any potential risk, contradicted with warfarin. Lactation makes up the potential risk for the baby. Use of heparin is suggested if an anticoagulant is needed during lactation. Renal or hepatic disease, which can interfere with the metabolism and effectiveness of these drugs. Heart failure, thyrotoxicosis, senility, and psychosis because of the potential for unexpected effects, and diarrhea for fever, which could alter the normal clotting process. In addition to that, you'll also have to assess baseline status before beginning therapy to determine any potential adverse effect. This includes body temperature, skin color, lesions, temperature effect, orientation, reflexes, pulse, blood pressure, and perfusion, respiration, and adventitious sounds. Also clotting studies, renal and hepatic function tests, complete blood count and stool guaiac and electrocardiogram if appropriate. Moving on to thrombolytic agents. Thrombolytic agents break down the thrombus that has been formed by stimulating the plasmin system. This process is called clot resolution. Thrombolytic agents include alteplase, also known as activase, retabase or retabase, tenecteplase or TNKase, and lastly urokinase or apokinase.
Therapeutic actions and indications. If a thrombus has already formed in a vessel, it may be necessary to dissolve that clot to open the vessel and restore blood flow to the pendant tissue. All of the drugs that are available for this purpose work to activate the natural anti-clotting system, conversion of plasminogen to plasmin. The activation of this system breaks down fibrin threads and dissolves any formed clot. The thrombolytics are effective only if the patient has plasminogen in the plasma. These are the list of drugs including alteplase or the activase, retaplase or the retavase, tenecteplase or the TNKase, and lastly, urokinase or the abokinase.
Pharmacokinetics of thrombolytic agents. So these drugs are given IV and are cleared from the body after liver metabolism. They cross the placenta, but it is not known whether they enter breast milk. Moreover, the most common adverse effect associated with the use of thrombolytic agents is bleeding. Patients should be monitored closely for the occurrence of cardiac arrhythmias with coronary reperfusion and hypotension. Hypersensitivity reactions are not uncommon. They range from rash and flushing to bronchospasm and anaphylactic reaction. Contraindications and cautions of thrombolytic agents. So the use of thrombolytic agents is contraindicated in the presence of an allergy to any of these drugs to prevent hypersensitivity reactions. They also should not be used with any condition that could be worsened by the dissolution of clots, including recent surgery, active internal bleeding, cerebrovascular accident within the last 2 months, aneurysm, obstetrical delivery, organ biopsy, recent serious GI bleeding, rupture of a non-compressible blood vessel, recent major trauma including cardiopulmonary resuscitation, known blood clotting defects, cerebrovascular disease, uncontrolled hypertension, and liver disease, which could affect normal clotting factors and the production of plasminogen. So these drugs are also contraindicated in pregnancy because of the possible adverse effects on the fetus or neonate. These drugs should not be used during pregnancy unless the benefits to the mother clearly outweigh the potential risk to the fetus. Caution should be used during lactation because of the potential risk for bleeding effects in the nursing body. Okay, so let's move on to the next reporter.
Contraindications and cautions. The use of thrombolytic agents is contraindicated in the presence of an allergy to any of these drugs to prevent hypersensitivity reactions. They also should not be used with any conditions that could be worsened by the dissolution of clots, including recent surgery, active internal bleeding, cerebrovascular accident within the last 2 months, aneurysm, obstetrical delivery, organ biopsy, recent serious GI bleeding, rupture of an uncompressible blood vessel, recent major trauma, including cardiopulmonary resuscitation, known blood clotting defects, cerebrovascular disease, uncontrolled hypertension, and liver disease, which could affect normal clotting factors and the production of plasminogen. These drugs are also contraindicated in pregnancy because of the possible adverse effects on the fetus or neonate. These drugs should not be used during pregnancy unless the benefits of the mother clearly outweigh the potential risks to the fetus. Caution should be used during lactation because of the potential risk of bleeding effects in the nursing baby.